Welcome and thank you for joining us for this webinar to learn more about the Medicaid Meaningful Use Attestation process and also audit guidance. A little bit of background information. I'm going to be joining you today. I'm Jocelyn Hansen from Medistar, and I also have Elliot Emer on the line from the Wisconsin Department of Health Services. He'll be available to jump in and answer some questions or point out some things that he and his team from the Department of Health Services EHR Incentive Program team, what they sort of encounter and maybe ways that we can help you troubleshoot before there are complications in your attestation. So welcome, Elliot.
Thanks so much for letting me join, Jocelyn.
You're welcome. So again, this was the webinar for the Medicaid Attestation and Audit Guidance. If you have Medicare providers, and that's who you really, that's the webinar you intended to participate in, that is at 2 o'clock today, and there is a link in the PowerPoint that was emailed to all registrants about an hour ago to register for that. It's entirely possible you also have both kinds of providers, so feel free to join again. We did make a concerted effort to separate content so that there wouldn't be any confusion. There's a couple subtle nuances between the attestation sites and the processes, and we didn't want to confuse it all in one webinar. So we are also recording both of those webinars, and they'll be posted on Medistar's website as well as emailed to anybody who has registered within a week of the presentation. So at this point, I have muted lines, so hopefully we won't hear any background information or hear about how great your lunch was. But there will be time for question and answer at the end, and I will unmute the lines at that point. So we also are planning sort of an open office hours time next month for just questions about the attestation process. So there will be more information about that as well. But today, our objectives are understanding the big picture of what this whole attestation process is about. We hope to get into much detail as possible. For some of you, this might be a refresher. For others, it might be the first time you see this information. We did take a look at who was registered, and there were for this webinar, and there was a number of people who clearly have participated before. So we're going to do a high-level review of the registration and calculating patient volume eligibility. But the primary focus, again, is going to be exactly what the title said, focusing on attestation specifically for AIU and the required documentation, and then the actual meaningful use attestation to specific measures and the required documentation for that. We're all familiar with the alphabet soup of acronyms that tends to shed light on a lot of different government programs. So just a couple of review pieces. CMS is the Centers for Medicare and Medicaid Services, and they set the framework for the EHR incentive programs, both for Medicare and Medicaid. DHS is the Department of Health Services. In this webinar, we are talking about the state of Wisconsin DHS and the Wisconsin Medicaid EHR incentive program requirements. Different states will vary, but obviously since we're in Wisconsin, that will be our focus. INA is the identity and access piece of the puzzle. This is where physicians and providers will have their actual identity and their access to these programs set up. An EP, for our intents and purposes today, is an eligible provider for the incentive program. That's not necessarily only physicians, but it could be nurse practitioners, not just MDs, but DOs, dentists, things like that. So the objectives and measures, the meaningful use goals are the objectives, and the measures are the thresholds in which an eligible professional needs to meet the goal. And you might also hear us talk a little bit about CERT, which is Certified Electronic Health Record Technology. So that's your software. And if you're using a software that's been certified to use for meaningful use, it's considered CERT. So looking at the big picture, I think based on some of the questions that my colleagues and I have found in recent weeks, I wanted to frame the big picture and when you need to do which pieces. So the program, regardless of Medicaid or Medicare, starts with registration, and that's done just once, and that's where you're just telling CMS, again, so back to the Centers for Medicare and Medicaid, hey, we're probably going to participate in the EHR incentive program. So at that point, you select whether it's going to be Medicare or Medicaid, and that is just done once. You don't have to renew that registration every year, and once you get paid, you're in that program. We'll talk a little bit more about that in a moment. Establishing eligibility for the Medicaid attestation happens every time you participate, or when I say you, I mean your EPs. This is where we're going to calculate that you're eligible for the program, meeting greater than 30% Medicaid patient volume, 20% for pediatricians, in a consecutive 90-day period. This can be done either calculating this as an individual EP or a group practice level, and we'll review those specific details in just a few minutes. But you need to be able to produce this data from your EHR, an outside billing contractor, or other means that are going to support this 20% or 30% threshold. It also does need to be uploaded at attestation, so it needs to be in some sort of electronic form. First-time attesters typically attest for the Adopt, Implement, or Upgrade year, also known as AIU. The attestation confirms that you have met the patient volume eligibility and have adapted, implemented, or upgraded to that certified software, so that you've either done AIU for CERT. How's that for an alphabet soup sentence? So to attest, you'll need to upload proof that you've done that adoption, whether that's a vendor contract. We'll outline those specifications when we get to the attestation piece. And then again, that patient volume eligibility. And then subsequent to that first year of AIU, there are 5 more years of attestations where you will indicate that you've met the patient eligibility piece, as well as answering questions with regards to the objectives and their related measures. And you'll also attest to clinical quality measures, and we'll discuss that later as well when we're going over the attestation screens. So that's the big picture. Register once, establish eligibility every year. Just do the AIU attestation for year 1, and then you have up to 5 more years to do meaningful use attestation for the 2nd through 6th year. The registration is just once per EP. It is done on that CMS portal, not on the state Forward Health site. The opportunities to change, these last 2 points are pretty important. The opportunities to change one program to another have expired. So if you had someone who was registered for Medicaid and they wanted to switch over to Medicare or vice versa, that is no longer an option unless the EP was never paid in the original program, and then there still are some caveats to that. And also, if you are registering, so if you haven't done this registration process before, and you're thinking, I'm just going to register and then I'm going to go ahead and attest, it does take at least 48 hours for that registration information to get from CMS, the federal site, to the state that this particular provider intends to be a part of the EHR incentive program. So you will not be able to proceed with attestation until that information is received.
That's right, Jocelyn. If I could just jump in real quick, this is Elliot Hamer with PHS Health Team. You'll actually, as like the application preparer, if you're doing this on behalf of your eligible professionals, you'll get emailed a welcome email from from our program, and that actually, kind of previewing what we'll go on to on the next slide, when you come into Forward Health, it'll have a link there, and so you'll get that welcome email. And so before that, what we'd say is to not go back into that CMS site, actually just wait 48 hours, wait for that email to come through, and then you can proceed on with the next step, which is, which we'll talk about more on the next slide.
Good point. I think every time, correct me if I'm wrong, Elliot, every time you kind of go back and check, that 48-hour waiting period resets. Yeah,
unfortunately, there's something about the system where if it's like sending the file, that registration file, to the state from CMS, if you go back into that registration record while that's processing, it'll interrupt it. So it stinks, and it can take more time if that happens. So that's why we just recommend wait for that email, and then once you get that email, it'll have that link, and then you can start that Forward Health piece, which
Sorry, Elliot. Are you still there? Just a moment. Somehow he got muted.
Sorry, I muted it myself. Yeah, you can go ahead. I think that's all I wanted to say.
Okay, I think we missed the last part of your sentence, though.
Oh, sorry. Yep, that's it. You just want to wait for the email, and it will interrupt the file from coming over if you go back into that CMS portal. So that's why we just recommend after you register, just wait for the email that says welcome. You can start the program, and then there'll be a link in there to get you over to that Forward Health portal and get started on the application.
Great, thanks. And again, this is per provider, so let's say you registered 5 people, you will receive 5 separate welcome emails.
Correct.
Right. All right, so when we're talking about registration, there's a screenshot here. Again, this is the CMS registration site. So there is the last slide of this presentation does have all of the links to websites and such that we're using. So I will review that when we get to that point. But so this is the CMS registration site. You'll notice there are 3 sections. It might be a little bit difficult to see. So we have our registration, and then the attestation, and then the status. So you'll go under the registration piece, and it's really generally filling out demographic information about that provider and what program. It shouldn't take very long to come up with. Once you get that welcome email, as Elliot mentioned, you will log on to the Forward Health portal. Now, we don't have logins to the site because we aren't providers, so that's why you're just seeing screenshots instead of us demoing that. But you won't see this screen until you actually log on. And then almost to the very bottom, there's this Wisconsin Medicaid EHR incentive program. Once you click that, you will see a list of providers. And I didn't mention this much here, but it's also linked in one of our resources. if you have a login yourself, the ideal thing is if you could be linked to the providers that you are attesting for and then just select them from a list. But they need to give you that permission to do so through the identity and access system. So I will point out some of the resources we have on that resource list, but if you don't have any permissions from any provider to get started and start doing an attestation, your screen's just kind of going to be blank. So the goal is to have providers linked to you, or if they prefer to log in themselves and do this process, they could certainly do that. Then they would need their login and password to Forward Health. So either they'll need to be connected to you to do it on their behalf. You will send a permissions request to them, and they will have to approve it. So that can get a little bit clunky, but again, we'll talk more about that when I bring up the resources. So once you select the screenshot and the provider, you'll select the program year for which you're testing, and then also indicate that certification ID or that cert ID. And that information will pull over and into this RNA contact information. So you'll first get started, select the right provider, select the program year, and enter a cert ID. If it happens to be defaulted in because you attested previously, just verify it's the correct one. Just because you're using the same software last year or in 2015 doesn't mean that there wasn't a certification ID number change for the subsequent year. So the RNA contact information is the information sent by CMS from their registration, and then eligibility will be what kind of provider you're testing for, if they have any sanctions against them, and attesting that they are not hospital-based, meaning they don't spend more than 90% of their time in the hospital. So we'll also review where the patient volume information happens, but that's another tab, as well as attesting to the AIU or to specific objectives will be on the attestation tab. You'll have an opportunity to review all of the data entered on the review tab, and then finally submit, which is where the uploading of documents and sort of signing off that the information is accurate. So I just sort of wanted to do a little bit of orientation here. You can jump from tab to tab, and I think it's also very helpful that on this, it's not until the submit tab that you have to actually upload documents. So you could save your work essentially, and then come back, and when you select that provider, it'll say, oh, here's program years 2016, it's incomplete, would you like to continue to edit it? And then just kind of pick up and jump to submit, upload your documents, and move on. So definitely can move around here. I would just say if you're going to make any changes to any particular tab, make sure you're clicking save and continue each time so that that information isn't lost before you navigate to another page. So patient volume is something, again, that needs to be substantiated every year of participation. And what you do is you look at a 90-day period, and I'm talking specifically for current attestation. You'll look either in calendar year 2015 or 16 and demonstrate that the individual EP sees either a greater than 30% Medicaid or needy patient population, or then again for pediatrics, greater than 20% of that Medicaid or needy patient population. You can also submit patient volume as a group. So if you have some EPs in your clinic that see less Medicaid and some that see more, we could try to average that out by using a group. So someone who wouldn't be eligible for Medicaid independently could certainly be eligible as a group when all of the patients are looked at as a whole. So as I mentioned, you can calculate for individual providers or for a group. Regardless of how you calculate, whatever method you choose, the calculation is the same. Again, it's a report of all patients for a consecutive 90-day period within the previous 12 months, regardless of payer. So you establish all of the patients seen in a 90-day period, and then you have a report of all of the Medicaid patients for that same 90-day period. The patient volume report needs to include the date of service, the patient name, and whether or not they are out of state, meaning a patient is covered by a state Medicaid encounter not in Wisconsin. And of course, we need to know what state that would be as well. If they're not covered by Medicaid, then who is the financial payer? So Medicaid, commercial. You can use general terms. I think different billing software can also, make those annotations in different ways. So as long as you provide some sort of key to understanding those abbreviations, you should be in good shape. For FQHCs or RHCs, the federally qualified health centers, or the rural health centers, also include patients for needy encounters, again, in addition to Medicaid and commercial, and we'll also need to know the NPI. So here's the example calculation. Again, the denominator are the encounters on all the days in that 90-day period with an individual for whom the professional was receiving services, regardless of payer. So the denominator is everybody, and the numerator, again, is just the Medicaid folks. It does say, this particular slide is from a screenshot from the individual patient volume, but again, concepts are the same. Whether it's group or not, we're going to look at all patients seen and for the denominator, and then the numerator is just the Medicaid or needy. The numerator gets multiplied by 1 minus the standard deduction, which accounts for, Ellie, you can probably articulate that a little bit better than I. It basically accounts for other Medicaid services that may or may not be covered under the program. Is that how that works?
Yep. Yeah, there's part of the CMS regulation on the rule just kind of states that if, if it's a CHIP, if it's CHIP rather than Medicaid, that it shouldn't count towards this this population, this patient volume that you're calculating. So each year we just come up with a standard deduction percentage that every provider is supposed to just kind of subtract out of that numerator. So in this year for program year 2016, that's 4.65%. So that's just why you see the calculation example the way that it is you just look at that total population of Medicaid members that was seen during this patient volume reporting period, and then you just have to multiply it by 1 minus the standard deduction just to remove that 4.65% what they've found is the average amount of chip encounters by a Medicaid provider. So it makes it a little more complex, but I think that this example here, you know, shows pretty clearly that, for example, if you had 33 patient encounters over that 90-day period, you multiply it by this factor in order to remove that standard deduction. And in this case, the provider has this 41%, and so they or 42%, so they're over that 30% threshold, and they're good to go on patient volume.
Thanks, Elliot.
You bet.
So the patient volume, these are screenshots again from the Forward Health portal. Again, you notice we are on the patient volume tab. And it just asks a few bits of information here. So do you practice predominantly at an FQHC or an RHC, yes or no? And then you let the system know, are you doing an individual or are you calculating as a group for your patient volume? The next screen will ask the 90-day period. It'll ask for a start date. The end date, it only asks for a start date. The end date defaults to 30 days later on the next screen. So it will say, if I put in a particular date, it will count exactly, I'm sorry, not 30 days, 90 days. I'm sorry, you may want to make that note on your slides. The end date defaults to 90 days later. So it will count specifically exactly 90 days. So make sure that your patient volume reports reflect that. So it's not necessarily an entire quarter if you have months that have 31 days, those types of things. So just be cognizant of that. So as far as entering the patient volume data, you'll have your provider, where they're working, the Medicaid only encounter volume. Notice it says in-state numerator. If you have no out-of-state Medicaid patient encounters, this Medicaid only in-state and Medicaid encounter volume total number will be identical. So again, if the only patients you see are from Wisconsin Medicaid, then the Medicaid only and the Medicaid encounter volume will be identical. And then again, the total encounter volume is all encounters regardless of payer. So including Medicaid, including commercial, including self-pay, all of those, everybody. But once you click Save and Continue, it will calculate that information for you and give you that percentage. If you find that really on any screen, if you make a mistake and want to go back, just click the previous, and it'll take you back one screen, and then again, make sure you save and continue, and then this screen would update again. For AIU attestations, you would then advance to the attestation tab. There's a lot of saves and save and continue, so just prompt through all of those until you get to the next tab. So you do have the option to select that you have adapted, implemented, or upgraded, and you'll complete the applicable questions regarding your phase. So let me back up a second here. So if you've just adapted, it'll likely just ask what, when that was. If you're implementing, it'll ask more specific questions as far as like what specifically have you implemented, what have you been sort of project planning for, and things like that. And if you're upgrading, then what, from what version to the next. So just complete the applicable questions regarding your phase. Do that save and continue until you get to the review tab, and that you can, again, jump to any tab if you see incorrect information. So even if you find that there's some incorrect information way back on the contact info, you can jump from attestation back there, change it, save and continue, come back and review. And then, as I said, there's a lot of saves, save and continues, things like that. Advance until you go to the Submit tab. And I'm going to show you the uploading process when we get to the Meaningful Use Attestation. But you will upload, again, for AIU attestation, it's required that you have that supporting patient volume calculation and that you document, you have documentation including the vendor, what your product name is, product version number of that cert technology. So once you've uploaded those things, you'll continue to follow the screens to complete the electronic signing of the attestation application. Until you see the screen with a green checkbox, your application has not yet been submitted. You will also receive an email that it's being processed, so I would hang on to that as well. So AIU attestation, again, you absolutely have to upload patient volume and the vendor information that supports your either attestation upgrade or implementation. So,
Jocelyn?
Yes.
If I can make one note here too, the other thing I think it's good to talk about is like, if you want to be the contact for this information, then when you're in the RNA doing your registration, and when you're in Forward Health doing the application for the incentive, what you want to do is just make sure that, you know, when you're getting started on this information, even though the application is for an eligible professional, for a provider, you know, at your clinic or practice, you just want to make sure that you list yourself as like the application preparer, as the contact, to make sure that you're getting this notification, these notifications, like this welcome email that we talked about, or the email that states that the application's been submitted and that you've completed it. Just making sure that I would suggest, you know, personally, that, you know, you list yourself as the primary contact when you, when you're filling out the application on Forward Health, and then also list yourself as the, as the preparer when you're doing, when you're doing the registration. And that way you can just make sure that you're getting all these notifications to let you know that you can either move forward in the process or that, you know, to confirm that the state has, you know, received your application. So just wanted to make that note. Thanks.
Yeah, that's a great one, Elliot. I have found in the past in working with clinics that if they sometimes just have like the physician be the contact, this is also where any kind of communication goes. If there's a problem with your attestation, if they need more information, if there is an audit, and, you know, some of those things get might slip through the cracks if it's just sent to the provider. So thanks for adding that. So again, just to review, everybody has been registered. We did go over the eligibility calculation because we are choosing to participate this year. Likely we're in this new scenario, we've already done AIU, and we're going to move on to talk about actually attesting to specific measures. So meaningful use attestation includes 4 topics. General requirements, meaning meaningful use objectives, required public health objectives, and clinical quality measure reporting. So very similarly, again, it's the same website. We are just on the attestation tab, and it's not the adopt, implement, and upgrade. It is way back when we selected the provider and what year of participation, the system already knows that they've done AIU before and what year they are in participation. So those AIU screens won't even be an option. So under attestation, again, we're starting with those general requirements. So it does ask, please demonstrate that in at least 50% of all of your encounters occur in a location where certified EHR technology is being utilized. Specifically, we're talking about all patient, the denominator again, all patient encounters where medical treatment is provided and or E&M services are provided. This is evaluation and management services in a location with or without certification, and then in the numerator, the patient encounters that are only in certification. So again, denominator is all patients. Some might be in CERT, some might still be on paper, but the numerator is just for those in CERT. The second general requirement is that at least 80% of all unique patients, and when we say unique patients, we're talking individuals, have their data in the certified EHR during the reporting period. So very similarly, the denominator is everybody that was seen in the reporting period, and the numerator is the patients who were seen by the EP in the reporting period that are not on paper. So again, everybody, paper or CERT for the denominator, just folks in CERT. And then again, we're only talking about a patient being counted once during the reporting period. So regardless of whether or not I'm seeing my physician 3 times, I'm only going to get counted once.
And can I make one just real quick point here, Jocelyn?
Yep.
And that is that this reporting period it's the EHR reporting period, which is different than that patient volume reporting period that we talked about before. So just making sure everyone understands that once you get to these general requirements and into meaningful use, your EHR reporting period may be for 90 days, and it could possibly be during the same period in the prior calendar year as your patient volume reporting period, but they are actually they can be independent. So you know, they don't have to be the same time, and just want to make sure that that's clear, and that for these requirements that we're just talking about data for that eligible professional, and it's not data for the entire organization or, you know, for the entire practice. So when we ask this question about unique patients seen by the EP, just making sure when you're calculating this that it's understood that it's for that individual provider, and you're not, you know, looking at this data for, you know, across the whole organization. So I just wanted to make that clarification.
Thanks, Elliot. That made me think of something else to point out. When we talked about being able to calculate eligibility by group, so you know, maybe a group of 5 EPs in an office, we're still attesting to what each individual did with regards to meaningful use.
Right.
So there is no group attestation as to whether someone passed, say, the medication, the CPOE measure for medications. That's still the individual provider achievement rather than the average of the group. That group calculation only comes into play for patient eligibility. So the specific objectives for meaningful use, we're not going to go through each one of them, but I did want to show you that there's sort of this table of contents that you will see, and every one of these 10 meaningful use objectives, you'll need to go in and click Edit to put in the information. Now, when you click Edit, this is the example of Objective 2, the clinical decision support. It links to the CMS guidelines in case you have questions on that. It will tell you what the objective is, so again, the objective is what's the goal of this particular objective, and then what is the measure, so how are you going to meet that. So right now it's the implementation of 5 clinical decision support interventions, and then it just says, did you meet this measure, yes or no? There's not a percentage base to this particular question. There might be an exclusion available. There might be a few left of stage 1 providers, but those sort of alternate exclusions are sort of going away. The one big one is that for these orders is that you need to have placed 100 orders of this type. So this particular exclusion says the EP wrote fewer than 100 medication orders. And that is in relation specifically to measure 2, that the drug and drug allergy was enabled for the reporting period. And again, that's simply a yes, no. It might be entirely possible that this information may or may not be on your dashboard reports from your vendor, simply because some just report on the numerical values of the numerator and denominator. I did want to take a second to talk about the public health reporting. This is Objective 10. So the 3 options for meeting this measure are to submit information to the Immunization Registry, to syndromic surveillance reporting for the state, or to submit data to the specialized registry reporting. The words that they use with regards to public health reporting is that you're in active engagement. And we'll talk in a moment about what that means. But it's generally that you either, in this particular case, let me back up for a second. This is information from the Department of Public Health for the state as far as what we are ready to accept, what we can, the services that they provide to the state. So they are capable of accepting immunization data, either from your software directly to WER or via WISHIN to WER, if that's not possible. If you are not already in production submitting syndromic surveillance data to the state, either through BioSense or through WISHIN, then they are not going to be collecting any further ambulatory data. So if you're not already in production, you could take an exclusion for this measure. And then they're also able to accept cancer case reporting. And again, when we're talking about this public health reporting, we're not talking about manually entering or sharing this data with these registries. It needs to be electronic data pull to electronic data pull. So just make sure I've covered everything there. So the screenshot that comes up is that, so this is for the Immunization Registry reporting. The EP is in active engagement with Public Health Agency to submit immunization data. If you say yes, these are the options for the active engagement. Either you've completed the registration, again, that's on the FRED's website, to say, yes, we would like to be connected to WER. That the other option is that WER has reached out and they're doing some testing and validation with you, or that you are already in production and are actively submitting data electronically to WER. If this option does not apply to you, there are a number of exclusions. It could be out of scope. Number 2 is not really applicable, that we are in a jurisdiction where there is no immunization registry, so I would not choose that. Likewise with the last option. So I would say for the most part, out of scope would be the biggest exclusion that I have personally seen working with. Anything else you'd like to add to that, Elliot?
Yep, for this one, yeah, for immunization, the first one would only be applicable in Wisconsin as you know, as WER is collecting this data electronically. So if immunization is out of scope, then you, you would be able to select that particular exclusion. And if you have questions about public reporting, attestation, we do have a website that that helps explain that. And we have a resource here at the state that can help you through any questions you have about public health and meaningful use. So you can always reach out to us or the folks at MetaStar to answer those questions.
Yep. All right. So the last piece is attesting to clinical quality measures. This has not changed over the last couple of years, so it's still 9 CQMs from 3 different domains. There are some preset CQMs for adults and pediatric, and also you can generally select any 9. If you have multiple EPs of testing, they don't have to choose the same CQMs, and there are no thresholds. You can certainly report 0%, 0 over 0 for your numerator and denominator if you have to.
Yeah, it's super important to know, and it's not something that's always very apparent, but we want to make sure that people are getting meaningful use payments, and that you don't stop your attestation just because you have 0 over 0 for one of these measures. So, yeah, I think that's a really good point. Thanks, Jocelyn.
Yep. Similar to the meaningful use objectives, the CQMs are in a menu format here. They are sorted by domain character, so you'll see care coordination, clinical process effectiveness. This is a very long screen, so we sort of have a little break in the screen, and then you'll notice that efficient use of healthcare resources comes later, so you just select the 9 that you would like. I think to sort of piggyback off of what Elliot said as well, there are 64 potential CQMs that any EP can attest to, but not every vendor has gotten certified to report all 64. So it's entirely possible that when you get to looking at your meaningful use reports or your quality reports, that there might only be 9 that your vendor has gotten certified in. And, you know, if they're out of scope for what you do, it wouldn't make sense to put anything but 0, 0. If I'm a dentist and it's asking about the immunization status for children, you know, I don't do that as a dentist. So it would be natural to put 0 for the numerator and the denominator. So just know that there might be options that you do very well, but your vendor does not capture. Once you have selected your 9, again, you'll have this table. You'll go ahead and click Edit, and again, you'll just put in the data straight from your report. So same idea with the Review tab. Review everything you've entered. Verify the numerators and denominators don't have any errors. Again, you can jump to any tab So again, if you made a mistake, say on the patient volume entry, click patient volume, save your changes, and then go back to the review tab. So the submitted tab is where you're uploading your supporting documentation and finalizing your attestation. And this is where you'll see the ability to upload. So you'll just click Browse to find the document you want to upload on your computer, network drive, thumb drive, wherever you have it saved. Select the document and click Open, and then it will fill into this line for Browse, and you click Upload File. Once you do that, you'll notice that it appears below, and it says the file has successfully been updated. You can upload multiple documents, but you'll notice right in the middle of the screen it does say that the only thing that can be updated is PDF, Excel, or Word documents, and that they cannot be larger than 2 megabytes in size.
Yeah, and we do recommend for the patient volume calculation, you know, most likely you're going to be using Excel to do that, and so it's not required to be in Excel, but we do recommend that what you're uploading is in Excel, just so you know, just so they can kind of slice the data. The application reviewer can slice the data in order to accurately verify, you know, that you've made that calculation correctly.
Once you've finished uploading, you can go ahead and finalize your attestation submission. Again, there'll be a number of screens as far as who is submitting the data, signing off on the accuracy, continue until you see the following screen again with that green checkbox. And you will see that the status is now submitted, and you can review your application. I would recommend that you either save that or print it for your records. There is a print button once you click on that review application. So the attestation and audit documentation, as far as supporting documentation, I wanted to just bring up the forward health update from April, and it's in attachment 4, so we're starting on page 13, but it does give guidance as to examples of supporting documentation. Now again, the patient volume piece is really the only thing that's required for meaningful use attestation. We do strongly recommend, though, that you upload any of your meaningful use documentation as far as your reports for clinical quality measures and also for the actual objectives. It's easier to look at that information and process that faster than to try to get in contact with you, say, hey, did you transpose some numbers, or this isn't exactly right, maybe we interpreted this wrong. Elliot, can you speak a little bit to what you guys see on a regular basis, or why this would be beneficial?
Yes, yeah, you bet, Jocelyn. Yeah, I think it does help with some of those if there is a question. So, you know, uploading you're basically these certified EHR technology generated reports. You're using those figures to type in and you know, attest to the application. So it's just that same piece of documentation that you used during your attestation. You need to keep that for your records. And then you're not required to upload it, but it really does help with, as far as when the state is processing these applications, you know, we do have people that, you know, spend time to, you know, look through the attestation. If they have questions, if you've uploaded these CERT-generated, you know, dashboard reports that shows, the measure numerator and denominator outputs, it can just help with the speed basically of application processing, and instead of having them have to reach out and ask questions. So that's the point of it, I'd say. Yeah.
So we talked a little bit about some of those general requirements and what to upload or retain for some of those, the patient encounters. But if we keep scrolling down, you know, there's recommendations for every other objective as well. So protecting patient health information, that's your security risk assessment. Hang on to that. If you did it through Metastar, you should have that final report from your wrap-up call with Brad. You can certainly list him as the person who you did the review with, and that we used HIPAA 1. The clinical decision support, description of what was implemented, sort of, I mean, I guess you're trying to tell the story of what your provider or providers did the previous year. So, for example, the security risk assessment, clinical decision support, that could probably be information that you're retaining sort of for all of the EPs, and would likely present that regardless of who was audited. Screenshots demonstrating implementation of the CDS rules, again, those clinical decision support CDS, that the drug and drug allergy interactions were on, and then for each of the individual objectives that require the numerator and denominator, retain that information as well as uploading it for your for each provider. I think it's important to note, just because you uploaded it, you're not going to be able to come back and look at it. So I would save a copy, like save an attestation folder for each provider. Wouldn't you say, Elliot? I mean, it's not like folks can log back onto the Forward Health portal and come back to the Submit tab and start opening what they had submitted.
Yeah, I would recommend it. Just I would recommend saving this information locally as well. Yes.
Yes. Okay. So it's about 10 pages long with regards to some things that they suggest. You'll notice this random sampling of patient records comes up pretty frequently. If you have like a sample of a Medicaid patient that would show or demonstrate all of the meaningful use measures, that would be great. So it's not like you have to keep, you know, a record of 20 of them, but something that would demonstrate that particular requirement. So one that might have had something with had a consult with someone else where you needed to do health information exchange, or one where you had to do patient education. There might be one patient that encompasses all of that. You may also need to gather that information from a couple of different patients. So again, this is from the April Forward Health update. I just want to get back to the PowerPoint here. So it's the April 2016 Forward Health update. It's Appendix 4, is that right?
Yep, and this information is also in the Forward Health online handbook. So if you're an application preparer and you have access to Forward Health, there's an online handbook that covers our program, and it's there's a topic that there's a topic just about meaningful use of certified EHR technology, and so you can get in there and look at it in there also.
So the resources, again, this INA site and user guide, that's information, again, on how to make those connections with your providers if you need to do that. Registration site, again, is where if you haven't registered for your providers, where and how to do that, along with that user guide. The Forward Health Attestation site, there's a link there, as well as the user guide that Elliot was speaking of. Again, these user guides, when I get calls for help, that's what I consult first. So, and if there's something that's not clear, then we'll escalate that to Elliot and his team. But a lot of that is, while it's long, it captures each piece. You have your certified product list, again, the supporting documentation that I just showed you. And then for those of you who really like a big picture, this Medicaid EHR incentive program is step-by-step. Does have the steps over here in the left-hand column, any links to resources or websites that you might need to use to accomplish that task, and then information you would need to accomplish that task as well. So if you kind of like this one-stop shop piece, you may like this. There is also a really neat, for you big picture folks, this is the certified technology documentation that's required, but this big picture sort of decision tree is pretty helpful for the big picture folks. Again, it still has the warning about waiting for 48 hours after registration and then the other steps you need to complete. So I just wanted to point that out as well. So I know that we have sort of exceeded our time here, but I do want to see, I think I had seen some folks write in some questions. I'm just going to do this. And put up our information. We assume you have questions. We are going to have an open office hours webinar on Tuesday, February 21st, which is an additional time to answer your questions. Please do feel free to reach out and contact your project specialist for assistance. We're here to help, but we can't read minds and know where you're stuck. And you can also email questions directly to DHS. So I'm going to leave our contact information up here as well, but I'm going to try to see what might have been in the chat box here. Regarding patient volume, does that include Medicaid secondary also? Elliot, can you take that?
Yeah, so it doesn't matter who the primary or secondary is. If it's if there's any claim amount for Medicaid, then it can be counted.
And then the second question was, does Medicaid payment have to be made in order for us to count the patient in the patient volume?
Nope. So it's it's just if it's based on the encounter. This is one of the tricky things about patient volume, actually, is that it's just based on the encounter. So if that was a Medicaid encounter, you can count it. It doesn't actually have to be a paid claim even. So hopefully that clarifies that. It's basically, how do you calculate it? So most people are going to look at claims as evidence of that. But if you're using some other sort of way to calculate it, that's a great question, and it's a Medicaid encounter. It doesn't definitely have to be paid. So I hope that answers that.
The last question I have in the chat box is, can I complete the AIU attestation for an eligible provider using 2016 statistics yet, or have I passed the 2016 deadline? Good question.
So, yeah, oh, sorry. I started answering that.
Oh, go ahead.
Yeah, so, yep, so if this provider meets the eligibility requirements for calendar year 2016, we actually allow attestations into 2017, so you can still start an application all the way up until the end of March. So using this website link to DHS, that's a good way to kind of get get started on the process. Or you can reach out to us using this general email address, or work with MetaStart, and we can. There's still time to get your applications in for 2016, and if you do have questions about working up to that point after today's presentation, we want to be able to answer any of those questions you have.
And again, the deadline for the Medicaid attestation is March 31st.
Correct.
So you may see a February 28th deadline that is for Medicare. So you folks get an extra month. I'm going to take a second to unmute the lines in case people had other questions, but again, my apologies for running over. If you do need to leave, please feel free to do that. But I am also going to unmute everybody. Any questions at this point?
I have one.
Yes.
I just am looking for some clarification on the actual patient volume 90-day period. It is okay to run them at the same time as the attestation period, right?
It is, yeah. So it's when I went over that, I was hoping I wasn't confusing anyone. So it can be, it just doesn't have to be during the same time.
Right, that's
period.
my understanding. Because I've had some conversations with people, and they're like, well, why would you do it that way? And to me, it seems so much easier just to keep it simple to do it that way.
Yep, it sure can. Yep, who am I speaking with?
This is Aaron Wallman from Children's Hospital of Wisconsin.
Okay, yep, thanks for your question, Aaron. Yep, and if you have any follow-ups, feel free to reach out to us. But yeah, that's exactly true. But sometimes we get people that say, oh, I thought it had to be the same time period, and so just want to definitely dispel that myth. But yep, you can use the same time period. That's allowable.
All right, thank you, Elliot. Appreciate it.
You bet. You bet.
What other questions do you have? I see someone also asked through chat, how do I get a copy of this presentation? Everybody who is registered was sent a reminder. Again, keep in mind we have unmuted the lines at this point. So if you could mute your own if you have some background noise, that would be great. But an email was sent to all of the registrants probably about an hour before this presentation that included a link to the PowerPoint itself. I would check your spam email maybe if you did not receive that. If you haven't received it at all, feel free, I'm just going to pull up my contact information again, and feel free to reach out to me directly.
And I actually, as an attendee, I just got another email from Nancy, and it has the presentation in it here also. Perfect. It just came through at 1:10 p.m., so everyone should have that one too.
Great.
With a survey also.
Perfect. I was hoping that would be linked in, but I wasn't entirely sure.
It is, yep.
This recording will also be available on our website within, probably within the week. Just needs to go through our IT department and marketing, and then it'll be up. So likewise the same for this afternoon. So if you aren't able to make this afternoon and you also have Medicare providers that you need to attest for, that information will also be on the site. Other questions? Someone said a Medicaid encounter is included even if Medicaid is secondary, correct? And that was a yes, correct?
Yeah, I think yep.
Yep, that's a yes. So any Medicaid encounter, whether it's primary, secondary, tertiary, gets included. Other questions? All right, seeing none and seeing none in the chat, I will go ahead and stop the webinar. We greatly appreciate you helping, or you participating in helping us get out the right information to you, and we definitely want you to be successful. So if you have further questions, please feel free to reach out to us before that March 31st deadline. Thanks, and have a great day.
Thank you.